Washington Journal continues.
Alex Tabarrok, who is a professor at George Mason University in the Washington, D.C. area and also a research director at the Independent Institute. Good morning. Thanks for joining us.
Pleasure.
The House taking up some discussion on organ donations and whether or not there should be financial compensation for those who provide the vital organs. What's your view on this?
Well, there are thousands of people dying every year, and they're really dying needlessly. And the only reason, in fact, that they're dying, in my opinion, is that there's a law which says that you can't offer financial compensation for organ donors. And I think, and the group that I've gotten together with, thinks that if we were allowed to offer financial compensation, then we could save thousands of lives every year.
How would you fund it?
Well, initially, we'd like to try some trials, and initially it could be funded by the federal government. Thinking more down the road, it can be funded just like any other part of medical care by insurance companies and other aspects of the health business.
Is there a concern, though, that people might get into the business of selling these vital organs in one way or another?
Well, I'm perhaps not even a concern, but a hope in some sense that there would be some incentives to increase the number of organs available. So I don't expect that there are going to be any people hawking organs on the street, and that's not what our proposal is about. Our proposal is about offering compensation to the families and the estates of those who give up an organ. Our
guest is Alexander Tabarrok. If you want to join us in the conversation and support this concept, the number to call is 202-585-3880. If you're opposed, 202-585-3881. And if you or a family member have been organ donors, 202-585-3882. Our email address is journal@cspan.org. As always, we link the website of our guests, and today you can get more information by going on to georgemasonuniversity.edu or independent.org. What is the Independent Institute?
It's a nonpartisan public policy research organization. It's based in Oakland, California.
And what do they do?
We do research on all kinds of issues. We do research on economics, on politics, history, and we put out books every year, including a book at the Entrepreneurial Economics, Bright Ideas from the Dismal Science, which has a number of papers discussing the shortage of human organs and how to solve that problem.
Can you provide an overview on right now what are the federal regulations, if any, when it comes to organ donations?
Well, the major regulation is a 1984 rule, 1984 law, the National Organ Transplant Act, and that's the one which prevents financial compensation, which makes it illegal to compensate anyone for procuring an organ for human transplant.
Let's get to your phone calls. Pittsburgh, good morning for Alex Tabarrok.
Yes, I think that the people should be allowed to take their organs, and if somebody needs one, they should be able to receive. It's just like any, it shouldn't be governed by the government, and it should be, and of course you're going to say, well, the people who can afford it are the ones who are going to get it. But it's like anything else. It's, if you're a big politician, you don't have to do certain things that us small people have to do. Therefore, if this is going to be a country of freedom and equal rights, any person should have a right to sell their organ at whatever price they could get. The doctors get big money for doing the operations, but yet they came out and said that poor people can get nothing.
Thank you. We'll get another view. This from Houston, Texas. Good morning. You oppose the idea? Why?
Yeah, I do. I think that once you make it compensatory, you're going to immediately create a black market. The best organs are going to go to the ones who can afford it, whether or not it's reported. The government's going to have to regulate who gets organs, which of the poor are going to be entitled to a certain percentage, and then you're going to get all kinds of profiling as to who gets what, and then we'll have to regulate which organs are good, which are better, and which are best.
Thank you. We'll get a response from both
Yeah, let me
views.
just make a comment on that, on both of those points. It's important to emphasize that what we're talking about here is compensation for organ donors. So we're not necessarily talking about, we're talking about brain dead donors, we're talking about the deceased, not necessarily talking about live donors. It's a different issue, it raises different problems. So In addition, we're talking about so not selling an organ, but being compensated for the estate of a family who gives up an organ.
In the book that you had mentioned earlier, published by Oxford Press and available through the Independent Institute, you indicate that only 15 to 25% of all organs that could be donated are in fact recovered.
That's exactly.
Can you elaborate?
Yeah, that's exactly right. There are about 6,000 deceased people give organs up every year, and there could be as many as 20,000, 24,000, 25,000 are organs available. So most of the organs which could be saving lives, most of the organs which could be giving life to people are being thrown away. They're being fed to the worms, if I can use that term.
Cape Coral, Florida, good morning. You support the idea?
Yes, good morning. I'd like to speak to the woman who called a few moments ago. There's already an organization that makes decisions about who gets organs, which persons have the most viable means of succeeding if the organs will help them, and that's not really the issue here. People don't realize that when a person has a car accident or something like that, if they haven't made that decision or spoken to a family member or something like that, those organs go wasted when they die. And as a physician, I see it every day. A person is a young person or don't expect to die, and they end up with viable organs that go to waste.
Thanks for the call. And let me follow up on something that you wrote in your book, that many people feel that organ sales violate a moral intuition on the human body. So based on the caller's point and what you wrote in the book, can you elaborate?
Yeah. I mean, there was a hearing on this yesterday in Congress, and a number of people raised this point. They feel that selling an organ or allowing compensation for an organ is a violation of some moral taboos. And I'm not uncognizant of that point, but look, thousands of people are dying every year. So perhaps some people find it distasteful. I understand that. But look, you have to weigh your distaste for this against the fact that 6,000 people, more than 6,000 people, will die this year because these organs are not available. And compensation can make these organs available. So on my view, when you're looking at the moral arguments, it's obvious to me that these lives count more for perhaps a little distaste that we have in our mouths because of this.
Alexander Tabarrok is a professor of economics at George Mason University and the research director at the California-based Independent Institute, also the co-author of this book, Entrepreneurial Economics, which is available through the Independent Institute. Our next call is Long Island, New York. Good morning.
Hi, I'm a liver transplant recipient, and I think this is a great idea. I saw how many people when I was on the floor for 2 months that died because of a lack of organs. I think something has to be done. Only the people that have been through this can understand. And I saw the families, how they suffered because so many organs go wasted. And I think this is a good idea. Morally, it's a rough call. And I also believe that possibly, just for compensation for the families, that something has to be done. If it's an incentive, it's a great idea.
Caller, when did you have your organ donation?
3 years ago.
And how are you feeling today?
I'm very grateful to be alive. I've come a long way. It's a long, hard haul, and I can't say enough for the doctors and the people involved in this. And it's a very tightly run thing, and the people are just wonderful.
How old are you, and how long had you been sick?
5 years. I was waiting for the organ. I'm 3 years post, and hepatitis C, and it's rough.
Okay, thank you for the call. We'll get another view from Bath, Maine, who opposes the idea. Good morning.
Good morning. Mr. Tabarrok, I know that you have good intentions with this. I just